Hi, my name is Alexis Decker, and this is my presentation on treatment evaluations for post-traumatic stress disorder for Psych 645 at Liberty University. So we're going to start by talking about what PTSD is, and we're going to use the DSM-5 criteria, and this criteria is for children 6 years and older. Under 6 years old, the criteria change a bit, so we're focusing on 6 and up. So exposure to actual or threatened death, serious injury, or sexual violence in one or more of the following ways: by directly experiencing the traumatic event, witnessing in person the event as it occurs to others, learning that the traumatic event occurred to a close family member or friend, and experiencing repeated or extreme exposure to aversive details of the traumatic event. The second criteria is presence of one or more of the following intrusive symptoms associated with the traumatic event, beginning after the event has occurred. So this is recurrent, involuntary, and intrusive distressing memories from the traumatic event, recurrent distressing dreams in which the content and/or affect of the dream are related to the traumatic event, dissociative reactions in which the individual feels or acts as if the traumatic event were recurring, and intense or prolonged psychological distress at exposure to internal or external cues that symbolize or resemble an aspect of past trauma. Continuing on, we're going to look for persistent avoidance of stimuli associated with the traumatic event beginning after the event has occurred, as evidenced by one of the following: avoidance of or efforts to avoid distressing memories, thoughts, or feelings about or closely associated with the traumatic event, avoidance of or efforts to avoid external reminders that arouse distressing memories, thoughts, or feelings about or closely associated with the traumatic event. Next, we're going to look for negative alterations in cognitions and moods associated with the traumatic event beginning or worsening after the event has occurred, as evidenced by two or more of the following: inability to remember an important aspect of the traumatic event, persistent and exaggerated negative beliefs or expectations about oneself, others, or the world, persistent distorted cognitions about the cause or consequences of the traumatic event that lead the individual to blame himself or others, persistent negative emotional state, markedly diminished interest or participation in significant activities, feelings of detachment or estrangement from others, and persistent inability to experience positive emotions. We're going to also look for marked alterations in arousal and reactivity associated with the traumatic event, beginning or worsening after the event has occurred, as evidenced by two or more of the following: irritable behavior and angry outbursts typically expressed as verbal or physical aggression towards people or objects, reckless or self-destructive behavior, hypervigilance, exaggerated startle response, problems with concentration, and sleep disturbance. So the duration of the disturbance is more than 1 month. It causes clinically significant distress or impairment in social, occupational, or other important areas of functioning, and the disturbance is not attributable to the physiological effects of a substance or another medical condition. So now that we know what PTSD, we're going to look at what PTSD is, we're going to look at who is affected. So it's estimated that 5% of adolescents ages 13 to 18 have PTSD, an estimated 8% are female, and an estimated 2.3% of males, and that's from the National Institute of Mental Health. Studies show that about 15 to 43% of girls and 14 to 43% of boys go through at least one trauma. Of those children and teens who have had a trauma, 3% to 15% of girls and 1 to 6% of boys develop PTSD. Rates of PTSD are higher for certain types of trauma survivors, and that's from the U.S. Department of Veterans Affairs. One important thing to note as we discuss this is that trauma is different for everyone, and that an event that we might not consider traumatic can be traumatic, especially for a child, and can have these lasting impacts, and can develop PTSD from something that you and I might never have thought of as traumatic. So trauma is more of an experience rather than event, and so that's important to keep in mind as you're working with anyone with PTSD, but especially children. So the first intervention we're going to look at is cognitive behavioral therapy, or CBT. So this focuses on how cognitions influence feelings and behaviors. The idea behind this treatment is that individuals with PTSD reframe their thoughts, which in turn results in changes to behavior and feelings. So one of the tools that CBT uses is cognitive restructuring. So it's a technique used to identify and challenge maladaptive or irrational thoughts, and it's often looked at as a 4-step process. So the first thing is that you're going to identify the feeling and the automatic thought. You're going to address the cognitive distortion. You're going to employ Socratic questions. And you're going to accept a rational conclusion. So in dealing with a child who has experienced sexual assault, we're going to identify the feeling and the automatic thought. So maybe the child thinks that she is responsible for her sexual assault. We're going to address the cognitive distortion and that she is taking all of the blame. Instead of placing any blame on the perpetrator, she is blaming herself. We're going to employ Socratic questions. So we're going to ask questions like, well, did you say you wanted it? Did you do this? Did you do that? And just kind of work through the questions that might come up. And we're going to accept a rational conclusion that it was not the child's fault, but that the child is a victim of somebody else. And so working to rechange that mindset. CBT is regarded highly in the counseling field as an effective treatment for a variety of disorders. One study of children with PTSD showed that they have about twice the rate of improvement as adults who also receive CBT. So it's highly effective in children. The study also found that 92% of children with PTSD who received CBT recovered as compared to 42% who did not receive treatment at all. The second thing we're going to look at is the physiological way of intervention. And we're going to focus on EMDR. So individuals with PTSD often have physiological sensations or symptoms related to the experienced trauma. In his book, The Body Keeps the Score, Bessel van der Kolk explores many of the physiological connections to trauma. Trauma literally changes the way that the brain is structured and responds to stimuli. If you haven't had a chance to read his book, I highly recommend it. It's very informative and can really help inform your practices when you're working with children or any victim of PTSD. So eye movement desensitization and reprocessing, or EMDR, utilizing an external stimulus, individuals are able to process memories more completely and create new associations between traumatic events and more adaptive memories and interpretations. This reprocessing is believed to allow for more rapid healing than traditional talk therapy. This is also really good for those really ingrained negative beliefs and working those out. So, EMDR has shown positive results in adults, but has not been utilized as widely with children and adolescents. One study aimed to develop an EMDR procedure more appropriate for children. Within the study, the authors found that children with PTSD who engaged in the modified EMDR treatment reported fewer instances of re-experiencing symptoms. The next intervention is group therapy. So group therapy fosters a sense of universality, community, and support for individuals with PTSD. This method is typically more accessible, especially within a school or community group. So one of the specifics that we're going to look at is Trauma Grief Components Treatment, or TGCT. This group therapy program implements CBT principles into 17 group sessions. This program is specifically geared toward teens who display PTSD symptoms and maladaptive grief associated with a traumatic event, such as war, loss, terrorism, or other traumatic losses. One study found that teens who engaged in this school-based TGCT had significantly better outcomes than their peers who engaged in a school-based psychoeducational and skills program. So this specific program for group therapy has been shown to be highly effective with teenagers. Next, we're going to look at using scripture as an intervention. So counselors can use scripture in a variety of ways. The Bible is experiential and a resource for maturity and wisdom. It's foundational as it serves as a starting point for basic assumptions and beliefs. It's contextual in that it allows us to understand human nature and purpose. It's axiological and provides standards for living. It's anthropological and provides a historic narrative of humanity and the effects of sin. It's canonical and provides a standard of truth. It's dialogical by providing resources for discussion and comparison. And Scripture is creative in allowing us to explore concepts and ideas that are outside the realm of basic psychology. So, specifically gearing it towards PTSD, Scripture memorization can serve as a positive affirmation. CBT, as well as other types of therapy, often utilize self-affirmations as a method of restructuring and changing cognitions. So this can be translated into biblical-based counseling through the memorization of Scripture. Clients learn to recall the Scripture during times of distress, as well as an affirmation of safety to remain grounded. So Isaiah 41:10, "Fear not, for I am with you. Do not be dismayed, for I am your God. I will strengthen you. I will help you. I will uphold you with my righteous hand." And Lamentations 3:21-23, "But this I call to mind, and therefore I have hope. The steadfast love of the Lord never ceases. His mercies never come to an end. They are new every morning. Great is your faithfulness." So these are just a handful of interventions that can be used with children with PTSD. It can be very complex in deciding the right treatment for these individuals, and it's important to be well informed. Here are my references. Thank you.